Yes, I welcome everyone to another webinar session from the Post-Service Department, Office of the Head of Service. Sincere appreciation for your consistent presence, and I'd like to acknowledge all distinguished members of Alausa, the Association of Lagos State Retired Heads of Service and Permanent Secretaries, and of course, our esteemed retirees and serving officers that are on this call. Welcome, everyone. Yeah, our topic for today is understanding colorectal cancer prevention and early detection. Well, before we start, I would like to call on the Director Post-Service Department, Mrs. Jorodola, to please declare the webinar open.
Good morning, distinguished participants on this call. I would like to specially recognize every member of Association of Lagos State Retired Heads of Service and Permanent Secretaries on this call, retired directors, and colleagues. This morning, we are looking at understanding colorectal cancer. And as we all know, cancer generally has been identified as the leading cause of death globally. From the statistics I have, not less than 10 million deaths are recorded globally from cancer. And one of the commonest type of cancer is the colorectal cancer that we are going to be discussing this morning. Distinguished participants, I want us to pay attention, ask questions. Let us engage our facilitator, who is an expert in this field. I want to welcome us once again to this call. And on behalf of the Head of Service of Lagos State, Mr. Olabode Aguru, and the Permanent Secretary, Public Service Office, who are both unavoidably absent this morning. They are both attending to some other important state matters. I declare this webinar open on their behalf. Once again, I thank us for joining and welcome to this call. Thank you. Request that our facilitator should introduce herself to us and then begin with the session. Thank you very much, Mrs. Aminah, Dr. Mrs. Aminah Adegoke. Please, you have the floor. Dr. Mrs. Aminah Adegoke, please do a brief introduction of yourself.
Okay.
And then go ahead with your presentation.
Dr.
Okay, I think she's back.
Good morning. Yes, our facilitator, her name is Dr. Aminah Adegoke, as the director said. She studied at the University of Lagos, and she's certified in leadership and management health. She got her MBBS at the University of Washington, and she's a distinguished medical doctor and healthcare leader. She has lots of experience in non-governmental organizations and government initiatives. She has driven efforts to enhance healthcare access and quality. She's the author of Defeating the Silent Killer, a personalized guide to managing high blood pressure and achieving wellness. Dr. Adegoke shares her expertise through impactful writing. She is currently employed as a medical officer at the Lagos State Ministry of Health, and she's committed to revolutionizing healthcare in Africa and beyond, empowering individuals to prioritize their well-being. Yes, Doctor.
Good morning. Thank
Good
you
morning.
so much. It's a pleasure to be doing this today. So good morning, everyone. Once again, I am Dr. Adegoke. So this morning, I would be discussing colorectal cancer, understanding what colorectal cancer really means. So we talk about the awareness, the prevention, and the early detection. So if you look at, can you light?
Okay, can you see the screen?
No, yes, I can see it now. So yes,
Okay.
please, the next image. The next image, please. The next slide. So
Is it
yes,
this
if you look
one?
at this shows, yes, thank you, ma. So this shows our internal organs, the liver, the stomach, the small intestine, and the large intestine. So that is what we have in our abdomen. So it shows the organs in our abdomen, and everything here is important for us to function properly. So our focus today is the large intestine, which is otherwise called the colon. The next slide, please. So colorectal cancer really is the third most common cancer worldwide, and it's the second leading cause of cancer-related deaths. So that is to show you why it is important to discuss this today. It is the second leading cause of cancer-related deaths worldwide. So it's very important we discuss this so that, the more we are aware, the more the number drops. And it affects mostly people aged 50 and above. And that is why this awareness is crucial for retirees, and I believe that most of the people on this call are retirees. So it's very important because it affects that age group. Once you are above 50, the risk factor, the risk of you having colorectal cancer increases. So it's very important we are aware of, the risk factors so that we can avoid the risk factors. Yes, so yes, like I said, the colon, which is a major part of the abdomen, so that's the large intestine. If you look up, sorry, the next slide, I want to show a graphical picture. So we have a normal colon. If you look through the lumen, there is nothing there. And then the colon with the cancer, you see those polyps, that have become cancerous. So this is normal colon. This is how it's supposed to be free. And look at the other side. So people with colon cancer will have something like what is in the next image. So yes. So what exactly is colorectal cancer? So it is the cancer of the colon or rectum. So that the colon and rectum, they are like part of, they make up the large intestine. So when we say colorectal cancer, that is what we mean. And it often begins, sorry, the next slide, ma. It often begins small and non-cancerous. So you can see if you are somebody that, uh, does regular checkup, you will most likely find out early that, oh, okay, it seems that I'm at risk of colorectal cancer because it starts small and non-cancerous. It starts as a polyp, and a polyp is a non-cancerous growth. And over time, over the space of years, like 10 years, then it now develops into a cancer. And the risk increases with age, like I said, 50 years and above. And that is why the retirees are actually, they are the best population to talk to because they are they are the ones at the risk of this particular cancer. And also family history. So people that have had cancer in their family, are also at risk of colorectal cancer. And also the lifestyle factors. Oh, lifestyle. What do you eat? What do you do? Those kind of things too can affect, your risk of having this cancer. So what's the global and the local impact? So we've had over 930 deaths globally in 2020, and it's projected that we are to have about 1.6 million deaths from this particular cancer. You know that deaths would not even the cases, but the thing about it is that if you detect early, it would not lead to death. And we found out that the incidence of this cancer has reduced in the high income countries like Sweden and the rest. Do you know why it has reduced? Because they have some of these countries are already putting the screening programs for colorectal cancer, especially for people that are in that age bracket. So that way it already reduces their likelihood of having the cancer. So yes, so effective screening program. So that is why it has reduced in the high income countries, unlike the low income countries. So who are people at risk? So let me reiterate again. People age 50 and above, people with family history. So this Lynch syndrome and FAP are just, genetic syndrome. So family history and genetic syndrome, those are things you can't control. We have things that you can control and things you can't control. So your age, you can't control it. You obviously continue to age. Then the family history, something you can't also control, or your genetics, you can't control those two things. So if those are one of the risk factors. Then personal history of colorectal polyps. So if the person has done a colonoscopy and colorectal polyps, they saw colorectal polyps, so that person is already at risk of colorectal cancer. Or some people have even had the colorectal cancer before, or any cancer at all already puts them at risk. So you can see these three things I just mentioned. They are not things that you can actually control. There are things that are not modifiable. And then we now have the things you can control that are modifiable, like unhealthy diets. So I would like us to, as much as we know the things we can't control, we should also know the things we can control so that we can control it and try to reduce it drastically so as to reduce our likelihood of having colorectal cancer. Unhealthy diets. So at age 50 and above, you shouldn't have any high intake of red or processed meats. You should be taking a lot of fruits and vegetable. Then also sedentary lifestyle. You shouldn't just sit, you should do exercise. Obesity. Once you're overweight, not even obese. Once you're overweight, you try to bring down your weight to the normal BMI. Smoking, excessive alcohol consumption. Smoking, you shouldn't even be smoking once you're above because it already predisposes you. Hello, can you hear me? I don't see the projection. Can you hear me?
Yes, me, I'm hearing you.
Okay.
On. You are
Okay,
audible, please.
let me proceed. So sedentary lifestyle, obesity, smoking, excessive alcohol. So please, if you are above, you shouldn't even be smoking because it's even a risk factor for many other cancers aside from colorectal cancer and excessive alcohol intake. So those things you can control. So try to avoid it. I don't know if you can get the projection back because I want to show you something, that just a graphical image so that you can remember all what I just mentioned now. So what I have is, I just have an image that shows who is at risk of colorectal cancer. Number one, age 50 and above, family history. So we should, as I'm saying it, we should be thinking of ourselves. Oh, am I 50 and above? Check. That's one risk factor. Oh, family history. Has anybody had cancer in my family? That's another risk factor. Oh, my diet. What kind of food do I eat? Do I eat food high in vegetable and fruits? Do I eat a lot of processed meats? Then your lifestyle. Do I smoke and drink? Then other medical conditions too. So yes, like I told you, there are risk factors that can change and that cannot change. The risk factors that can change, you have that cannot change. Your age cannot change. Personal history of polyps or colon cancer, family history of colon cancer, those things cannot change. The things that can change, that you can change, which I want you to focus on is number one, physical activity. Do a lot of exercise. Once you are above 50, you should be doing a lot of exercise. Even if you are not, because some people will tell you, oh, I'm not fat, so why am I doing exercise? No, even if you are not fat, do a lot of exercise. Obesity, and if you are obese, try to bring down your weight to the normal to normal level. Then smoking, stop smoking. Then your diet, work on your diet. Reduce, processed or red meat, meat high in fat. You should take more fruits and vegetables and fish. Then people with type 2 diabetes too predisposes one to colon cancer. So if you have diabetes, make sure it is well controlled. Then, so what are the warning signs? What are the slide? I don't know if maybe when the slide comes back up, I will just go back to some of the images I am explaining so that you can just, because sometimes you need to see some things for it to remember. So then what are the warning signs? What are those things that you see now, that, wow, this doctor said this today. Let me go to the hospital and get screened. Number one, blood in the stool, bright red or dark, blood in the stool. If you see any blood in the stool, yes, that is a warning sign. Immediately report to the hospital. Blood in the stool, in your feces, blood. Number one. Number two, change in bowel habits, diarrhea, constipation. If you notice that you're not someone that is usually constipated and you have been eating, your diet has been very okay. So why are you constipated constantly? Immediately report to the hospital, especially when you're above 50. Those are warning signs warning signs. Doesn't mean that for every constipation you have colorectal cancer or for every diarrhea. But when some things just change drastically and you're in that age range, it's best to go to the hospital and then you get the doctor sees you and then you go for like a screening so that you are sure and you know what you're dealing with. Number three, unexplained weight loss. Unexplained weight loss at that age is a warning sign for cancer, not just colorectal cancer. Then number four, persistent abdominal pain or cramps. If you notice that your abdomen is always paining you and all that, those are warning signs. You're always tired, weakness, anemia. Every time you check your blood level, they say it's low. Those are signs, because if you are losing blood in your stool, definitely your blood level will be low. So those are early stage. Those are the signs you see. And although with all the signs, some people still end up having it and they don't have any signs, any symptoms in the early stages. So that also occurs, that people that have it at the end of the day, and they will tell you they did not experience any of these symptoms. So that is also possible. But if you see any of these warning signs, please report straight to your hospital or your doctor. Number one, let me recap. Let me recap so that since when we can't see it, so let me recap. Blood in the stool, blood in your feces. Number two, change in bowel habits. That is maybe, all of a sudden you start having diarrhea or constipation or narrowing of your stool. Number three, unexplained weight loss. You just started losing weight without, not like you are trying to lose weight intentionally, but you just started losing weight. Then persistent abdominal pain or cramps. You're just having abdominal pain or cramps without any particular reason that you can remember. Then tiredness. You always feel tired, weak, and anemia. That is a low blood level. Yes. So what do you do? So you are supposed to go for your regular screening. Okay, so now we are back. I think the slide will be back up soon. So yes, regular screening. Regular screening saves life. So once you are 50 and above, it is recommended that you go for colorectal screening. And what are the methods include? Number one, fecal occult blood test. So the use of feces. That's number one. Number two, colonoscopy. So like a camera will be put into your colon to view your colon. If you can remember on the second or the third slide, I showed you what a normal colon and a colon with a colon cancer looks like. So they will put it in like a camera to view. Okay, yes. This image now is what I spoke about. Sorry, I want to go back so that we can just have a pictorial view. This image on the screen now just shows the risk factors. Like I said before, age 50 plus, family history, your diet, your lifestyle, and the medical conditions. Okay, ma, please, you can skip this slide. We have already gone past this. So let me continue what I was saying. So yes, please skip this slide. We have discussed this already. Please, next slide. Hello, can you hear me? Hello.
Yes, we are hearing you.
Okay,
Doctor, we can
so I
hear
don't know.
you.
I want her to go to the next slide, please. Next slide. I want the slide to show what I'm talking about currently. Next slide,
Is it
please.
this one? Is it this one?
No, ma. No, ma. Next slide. We've gone past this. We've gone past this too. Next slide.
The next slide. Yes. This is where we are.
Yes, this is where we are. So yes, so I was talking about screening. So it is recommended for people aged. You can leave it here, ma. Oh, no, ma. No, ma. Please go back. Please go back.
Is it prevention? Where exactly? Which topic are you on?
Please
Which
go back.
page? So I'll just to that page.
Colorectal cancer screening
Picture where you
methods.
have
Go
the
back to
intestine.
colorectal cancer screening methods, please.
Yes.
Okay, all right.
Yes, yeah, here. Can just stop there. So yes, so we have once you are above 50, you're supposed to go for the screening, even before any of all those symptoms I mentioned starts to appear. So you're supposed to have gone for the screening so that you know that, oh, okay, I'm not at risk. Oh, okay, I'm at risk. So the first one is the one that is not invasive, that they don't have to put anything in your body. That is also convenient and effective. It is stool-based one. That is the fecal occult blood test. So they'll take a sample of your stool and they'll test for it. They can also do a stool DNA test, so they'll do that and test for it. So that's for that one. You don't have to. It's not invasive at all. You don't have to put anything in your body. Then another one is the colonoscopy, which they'll put a probe, they'll put a camera into your colon. So that is from that, so they can view your colon, so they'll know whether it is normal or it has any cancer in it. You can also do a CT colonography.
Okay. No,
Lipid
sure, she do
biopsy.
it. No, she would have seen it.
They also
No,
take
it's
a
look
little, they can also take a fluid from that colon and take it to the lab to check for cancer. So those are the ways you can screen. But for us here, the first method, if you want to screen, is your fecal occult blood test. So you take your feces and they'll screen it. And another very effective method is also the colonoscopy. You see a lot of people will tell you, oh, once you're above 50, you should go and do a colonoscopy. You should have done at least one colonoscopy. Then so now we've spoken about the science, we've spoken about how you can screen for it. Now let's talk about the prevention. Next slide. So how do we so now that we are here, we know once you're above 50, you are at risk. Okay, so from my end though, what things do I do to be able to prevent colon cancer? Number one, you eat more fruits. Number two, eat a lot of vegetable and whole grains. Avoid processed and red meat. Number four, stay physically active. Always do physical exercise. Sometimes instead of driving, you walk. When I mean walk, not just walking, you walk briskly. That it takes time for any other person to catch up with you. Then don't smoke. Limit your alcohol intake. Avoid environmental risk factors like pollution, like air pollutants, because some of those air pollutants also contain some chemicals that can predispose one to cancer. Then regular screening, very important. So if you're above 50, go to your doctor, and tell them to write colonoscopy for you so you can go and get it done at the lab, or your fecal occult blood test. So yes, so just go and do one colonoscopy if you're above 50. Yeah, so now this image, the next image here, it shows, I don't know, the slide, I think the slide has gone off again. The image I have that I'm supposed to show you now also shows the cancer causes, the risk factors, and the prevention. So the causes and risk factors of this cancer is number one, obesity. Very important, obesity. So if you're on this call, I know you're obese. So please, let's try to drop our weight. And how do we drop our weight? By controlling our diet and by doing physical exercise. Then alcohol use, alcohol intake. Let's reduce the alcohol intake drastically. Reduce it drastically. Then no smoking at all. No smoking at all. Then, so how do you prevent it? You make sure that your your weight is the normal weight. You are not overweight, you are not obese. You limit your alcohol intake, you avoid tobacco, and then you see your doctor regularly. Once you are above 50, you should see your doctor regularly, so you can do all the screenings necessary to avoid things like cancer. Then make sure you are eating well, healthy diet. So yes, colorectal cancer is treatable. Yes, we've spoken about that. We've spoken about how to prevent it, and people that have it already, how do they treat it? It is actually treatable. It depends on the stage in which it is found out that okay, this person has colorectal cancer. For some people, it's still at the early stage. They can just do surgery. For some people, it has spread. They might have to do chemotherapy or radiation therapy. So early detection leads to higher survival and better outcomes. So for people, so that is why I said screening is very important, so that even if the person already has it, they can detect early, and the chances of surviving is really high when you detect it early. So how do you diagnose it? We've spoken about how to diagnose it, same as the screening. Number one, we use the imaging, that is the colonoscopy. You can use CT too, and then biopsy. They take a part from the colon and then they take it to the lab for test. So that timely diagnosis is critical to guide effective treatment. So yes, so this is what I mean by colonoscopy. Please go to the next slide. This is what I mean by colonoscopy. They actually pass a colonoscopy tube into your colon, and so they can see what is going on in the colon. See, look at this. Imagine, sorry, can you go to the next slide? It has an image, yes. Imagine they see a colon polyp. So colon polyp does not mean colon cancer. So the surgeon can go in and take it away and then do a biopsy and find out, okay, it's not cancerous. But what that just means is that, oh, this kind of person is predisposed to colon cancer. Colonoscopy, as I was saying. So if they go in and they see this polyp, all they need to do is remove it, take it to the lab to test if it's cancerous or not. And if it comes out to not be cancerous, that just means this person is already predisposed to colorectal cancer. And yeah, so it's better they remove it, because if you leave it there, it would eventually become a cancer after like 10 years. So it's best to remove any polyp. So that is why a colonoscopy is very important if you are 50 plus stage. So if it's at the early stage, the most likely thing that will be done is surgery, and it may or may not include chemotherapy. So, and after the surgery and chemotherapy, they'll keep surveying, they'll keep, checking to make sure that, oh, the person is truly clear of the cancer. But if it is at the advanced stage, it has to be something that has spread. So it has to be something else, more like mostly chemo. And they can just do surgery or radiation to manage the symptoms, and supportive care to improve the person's quality of life. That's what will be done. So that's why I said it is for colorectal cancer, most especially, it's very important that one does the screening, because if you catch it early at the polyp stage, there's a likelihood you will not end up with a cancer. So now let's talk about the myths and the truths of colorectal cancer. So one myth is, I feel fine, so I don't need screening, which is not true. It is not true at all. Like I said, I mentioned the warning signs, which included seeing blood in your feces, abdominal pain, unexplained weight loss, constipation or diarrhea, like sudden constipation or diarrhea. Some people don't even have any of these symptoms and they still end up with colorectal cancer. So even if you feel fine, it doesn't mean you can't have colorectal cancer. So screening is important for everybody above the age of 50 years. Number two, only men get colorectal cancer. That is absolutely not true. Both men and women get colorectal cancer. So if you are a woman or if you are a man, please get screened. Then screening is painful. That is also not true. Screening is not painful. There are tests that are non-invasive. Like I said, the test your feces. So that is non-invasive and it's quick. So screening doesn't have to be painful. So those are the myths, and I've told you the truth now. So that, yeah. So what can you do today? So now you've heard me talk. I've gone on and on, maybe almost 30 minutes talking about colorectal cancer. So what can you do from hearing this? Number one, you go and talk to your doctor about screening. Go and get screened. Encourage family members to screen, especially above the age of 50, and adopt healthier habits. So if you smoke, please stop smoking. If you drink a lot, reduce the alcohol intake. Very important. Your diet. Eat a lot of fruits, vegetables, reduce your salt intake. Make sure you are eating healthy, bad oil and all of that, reduce it drastically. Then stay informed and alert to any changes. So you should know your system. When you notice, oh, okay, I'm usually not constipated. So why have I been constipated for the past 2 weeks? Don't just, ignore it. Go straight to your doctor. So be alert about your body changes. It's very important. Those are the things you can do from listening to this discussion today. Then I have a message for you. Retirement is for enjoyment, not illness. Your health is your most valuable asset. You have worked and worked and worked. So it's time for you to enjoy. So your health is your most valuable asset. Inspire your children, grandchildren, and community to live well by eating well. Be proactive about prevention and screening. So that is very important because it's time for you to enjoy. So make sure you take all the preventive steps. Make sure you get screened. Very important. And let me summarize all what I've been saying since morning. Colorectal cancer is common, but preventable and treatable. Early detection saves lives. So very important to detect early. Healthy habits and regular screening are key. Let's protect our health and encourage others to do the same thing. Very important. So at this point, I have finished my presentation. If you have any questions or concerns, I'm here to answer them. Thank you.
Very much for the presentation. Thank you. Yeah, so please, if we have any questions, please, can we raise our hands and you'll be called on, or you can drop your questions in the chat box, please.
We already have someone that signified. Mrs. Aidiroda, she has signified. I think she can unmute and speak. You can unmute, ma, and speak.
Good morning, Doctor and the House. Thank you for this presentation. You mentioned that this cancer is common among 50 and above. Are you saying that those who are younger than 50, who are less than 50, can't have this this cancer?
Colorectal cancer.
That's what, because I know.
Doctor, did you hear that?
I know
Yes, I got it. Hello, ma. Is that all?
Yes.
So, ma, thank you so much for the question. To answer your question in a nutshell, even if you are below 50, you can get colorectal cancer. It is just commoner among people above the age of 50. So if it's like mandatory, if you are above 50 to go and get the screening done. But if you are below 50, yes, there are people below 50 with colorectal cancer, but it is not as common in that age group. Thank you, ma'am. I hope that already answers your question.
Thank you. But those who are younger, do they have the chance of survival? Less than 50?
Yes, they do. Yes, they do. Especially if they notice the symptoms early and they go in for screening. So that is the catch. People younger, they should be aware of their body changes. So once they notice any, maybe any blood in their stool or unexplained weight loss, they should go in for screening. And when you are younger, and that's why even going for regular medical check is not just restricted to people above that are older. Generally, as an adult, we should have that approach towards our health. We should be very conscious of it. So if you are somebody that is conscious of your health, no matter the age you are, once you see any changes, you would go for screening and get the necessary treatments. I hope I've been able to answer your question, ma.
You have, but you see, you mentioned some of the signs. This young man said for a long time he's had stomach pains and he's been to the hospital. He was told something different entirely. It wasn't diagnosed until he traveled to UK. It was realized that it was colorectal cancer. So I think our doctors too should pay more attention when people complain about stomach pains. That's what. Thank you. I appreciate your presentation. Thank you.
Yes, ma'am. Thank you, ma'am, for that comment, which I agree with you. We should always be, as doctors too, we should be at alert when patients present with some certain symptoms, especially consistently. Yes. So yes, reading from the chat, somebody asked, ma, you asked which is the best all-round diagnosis
sorry, go
we
ahead,
can
please.
take? Okay, will MRI be better if we can afford it? Please, which is the best test for all cancer detection? Okay, so basically for colorectal cancer, colonoscopy is the gold standard. Colonoscopy, that is enough for colorectal cancer. But for all-round cancer, there's something called PET scan. It's quite expensive, but that is, the route that can be taken if you want to screen for all-round cancer. I think it can be done at some of these big diagnostic centers, yes. But for colonoscopy, for colorectal cancer specifically, the gold standard is colonoscopy. Then can STD promote colorectal cancer? No, STD cannot promote colorectal cancer. Please, good morning. Okay, please, can you tell us where we can go for screening, ma'am? Yes, you can get screened at any standard lab. The standard labs, at the general hospitals or the teaching hospitals. Yes, the standard labs at teaching hospitals, and if you know any other accredited private labs too, you can visit. Yes, most of them should have colonoscopy. Yes, I think I have answered the questions on the chat box. Coordinator, ma, over to you, ma.
Yes. Actually, I even have a question. It said something about obesity. Can obesity cause it?
Yes, ma'am. Obesity is a risk factor, not just colorectal cancer, so many other things. So obesity is a risk factor. So obesity is is a red flag for so many things. So it's always very encouraged for one to bring down the weights. Very encouraged.
Oh.
I think there is a question that you missed out on the chat. How often can one do the colonoscopy? How often? Doctor, are you there?
Okay, how often should
How
one have
often
it?
should one go for that test?
Okay, ma. If you do it once, like now we've spoken about, if you go and do it, if it comes out normal, then do it once in every 10 years.
Okay. Once every 10 years. That's good.
Then if it's not normal, you go straight to the hospital so that they can take it up from there. But if you do it now at the age of 50, when you're 60 again, you go and do it. When you're 70 years, so that's the standard. Just saw a comment now. Is colorectal cancer the same thing as bile? No, colorectal cancer is not the same thing as bile. Yes, but they can present the same way. So you can have some symptoms, yes, but it's not the same thing as bile. Bile is hemorrhoids,
Okay.
not colorectal cancer. Okay, coordinator, ma, over to you, ma.
Yeah,
I
there are
think there are
just many
two more hands on.
Okay.
I can see one Mrs. Bimbo Awu Shiyon.
Okay. Yes.
Okay, go ahead with your question.
Okay. Good morning, everybody. It's an interesting program we had this morning. Our health is our business. Everybody should take it interesting and intentionally. Recently, I was involved in 3 people that are very close to me, because after my retirement, I took into naturopathy, and they are still on, and I've been practicing side by side before I retired. So there was one, that was why I was going to send a message, but then doctors mentioned this 10 years, because initially it gave us the impression that they can be doing regular screening. I was going to say, a friend of mine who went, she was chased back and said she should come back 10 years later. So I cleaned the message. I didn't bother to send it. It's true, 10 years difference. She was actually diagnosed, and there were, they raised some eyebrow concerning her feelings at that point in time. And at a point in time, it jilted her mind, and her body was peppery with rashes and things like that. But to the glory of God, she was always coming to me, and I tried to pacify her and introduce her to these vegetables. And also, we use some of our herbal products that are original and ingredients that are natural, and she got better. 2 others were treated by myself. One was from the UCH in Ibadan, and another one from SDM, Seventh-day Adventists in Ife. Can be, if they can get proper ingredients that are natural, just like our vegetables and smoothies that can be taken fresh. So that many people, when they go for this kind of training, they get fearful and they get disturbed so much that it will even worry them and disturb the endocrine system to an extent that you can even take some of them even to psychiatric level. So sometimes when they meet counselors that are naturopathy, people like our fields, we try as much as to allay them first that the body itself, under normal circumstances, if it's given the right environment, it can heal itself. If after maybe the body has been condescended into so much chemicals in the body. A lot of people go for this agbo that they cannot even explain the chemical reactions that it does to the body, apart from the hospital drugs that is given to them. Many of them will take to, there's the one stick there, one leaf there, and they don't know the composition. They don't know the pollen grain that is on it that can even cause some adverse effect. So that's just my contribution, that they can get help when they get the right environment to assist them. That's just what my contribution to this. Thank you very much, ma, for this explanatory, kind of a thing, because cancer, when you people hear cancer, is another thing. Some people will even die before their time in terms of fear. Thank you very much, ma.
So on the chat, I can see another question. How do you differentiate between bile and colorectal cancer? So the differentiation is not for non-medical people to do. It's for your doctor to do, because the symptoms are similar. So if you have any symptom like frequent constipation, blood in the stool, anything that you think is bile, go to your doctor. Let your doctor diagnose you and tell you, okay, this is bile. This is not colorectal cancer. Oh, okay, this is colorectal cancer. So it's not something I would advise a patient to diagnose by themselves. So if you have any off symptom, just go to the doctor. They will tell you to do some tests and they'll diagnose appropriately. Don't assume, please. So, coordinator, I have been able to answer all the questions I could see on the group chat, chat box.
I think Mrs. Aide's hand is still on. Maybe she still have a contribution or a question to ask. You can unmute, ma. Mrs. Aide, yes.
Thank you once again. I just want to ask the doctor, if after 10 years that you have done the colonoscopy, and then you've done your normal screening and the stool test shows that there's no problem with the stool, do you still have to do that colonoscopy after the 10 years?
Okay, ma, it is routine after this. It's like every 10 years. So after 10 years, you do it again. So they'll tell you again, is this thing normal or abnormal? So anything can, that's why they say 10 years, because like I told you, it takes 10 years for a polyp to change. So you do it again after 10 years.
Okay, despite the positive stool test.
Exactly, ma. So you are going again for another reassurance after 10 years.
Okay, thank you. Because I did. 11 years ago. Okay, thank you.
Somebody is asking a question here. The person said, is it true that 80 years cannot be allowed to do colonoscopy? Doctor, are you still there?
Yes, ma'am, with you, ma'am. So, like I said before, yes, colonoscopy is actually encouraged from the age of 50. So even if you are 80 years old, you can do colonoscopy, But in cases whereby that 80-year-old person has some significant health issues like advanced health or lungs or kidney disease, the person might not be able to do colonoscopy. So that is for when the risk, we have risk and we have benefits. When the risk outweighs the benefit. So that's for the doctor to say. So there are some conditions the doctor knows this person cannot do this procedure. They won't write it. But generally, for a healthy 80-year-old person should be able to do colonoscopy.
All right. So is there any alternative if maybe colonoscopy is not safe? Did you hear that, doctor?
Sorry, ma'am, come again. I didn't get you.
I said, in case colonoscopy is not safe, is there any suitable alternative?
Okay, for that kind of person, they will be told to do some other non-invasive tests instead of colonoscopy, like MRI.
Okay.
But it's not for the patient to determine. The doctor, in the first place, will not even write colonoscopy for any 80-year-old that cannot be allowed to do so. So the doctor will have written another alternative instead of colonoscopy. Any other questions, please, or concerns?
Yeah, well, no more hands are raised and there's no more question in the chat. So I want to assume, I want to assume that we are all satisfied with all the responses to our questions and concerns. And I think the host, the network of the host is acting up. So on behalf of the head of service and the permanent secretary, we have come to the end of this webinar session. I would like to invite someone to please appreciate the facilitator on our behalf. Please, can somebody signify and appreciate the facilitator? Okay, let me invite Mrs. Aide Rhoda to please appreciate the facilitator on our behalf. Oh, did I see any hand?
I was just going to talk. I was trying to
Okay.
unmute. No
Oh,
problem.
Mrs. Adeneye, good morning, ma.
Good
Please go ahead.
morning. God bless you. Good morning, head of service and permanent secretaries, everyone on the platform. Wonderful, wonderful lecture. Thank you, doctor, for opening our eyes to those various things we need to really take charge of and not to have any fear. Thank you even for that contribution that we also had for the ground on the natural way to go as well.
Thank you, our speaker. We give you kudos and we say more grace to your elbow. God bless you real good. Thank you, the organizers. God bless you. Thank you.
Thank you very much, ma. So on that note, I want to appreciate each and every one of us on this call for always returning. It is because you keep returning, that is why we keep coming back every 2 weeks. We have come to the end of this webinar session, and I want to advise us once again, let's ensure that we do our regular test. We have this webinar on our YouTube channel. We can always go back there, listen once again, take note, and take action. That is very, very important. Thank you once again for joining us. So on behalf of the Head of Service and PSPSO, I want to declare this webinar closed until the next 2 weeks, when we'll be coming back with another interesting topic. So like we usually do, the floor is open. We can unmute, put on our videos, and say hello to someone that we have not seen in a while. Thank you very much.
Good morning, Mr. Osefa. Good to see you here.
Karoma, nice seeing you.
Carol, Mrs. Urodola, thank you for this regular. God bless you. Mr.
You're
Osefa,
welcome, ma.
I hope you are doing good.
Good morning,
Good
Miss
morning, Mrs.
Rodola.
Zodola.
Thank you.
Carol,
You and your team. We appreciate you very much. God bless you.
You're
I think I
most
cited my
welcome.
friend too, Mrs. Solayede. I wish you is pretty. Good morning.
Sure.
Nice week. So I see that again.
Thank you,
Good morning, ma. Mr. Motosho is here greeting you. Thank you for all you do.
Most of us are not on video. Ẹ jẹ́ ká gbé fídíò wá sí now. Are we still on the bed? Ilẹ̀ ti mọ́ now.
We are retirees now. We can afford
No,
to be on the bed.
understand. So I understand some people can still be on the bed. Ẹ jẹ́ ká jáde láyé under duvet now. Ká ṣe exercise. Doctor ti advise wa pé ká ṣe exercise. Jẹ́ ká dìde ká exercise.
Ms. Rodola.
Thank you. Good morning, ma.
Yes, ma. Mr. Motosho.
How are you? Orulawawa.
Only about 4 of us.
Bimbo.
Ago mẹ́ta làwa wà o.
Good morning, Mrs. Rodola. Good morning, everybody.
Good morning, ma.
Good morning. Good morning.
Yes, Mr. Adelaja.
Happy to be here.
Mrs. Rodaja.
Taiwo Kọ́láwọlé.
Mrs.
Ẹ káàárọ̀, ṣáwọn ti Ṣómólú
Ó
nìyẹn.
dà kí mi ti tòdúgbò wá nìyẹn. Kúkú rójú yín náà.
Mrs. Ogundimu ló ń kí yín o. Ẹ káàárọ̀, Mrs. Rodola.
Ẹ káàárọ̀, ma.
Good morning, Mrs. Rodola.
Mrs. Ayinde.
Ma, good morning, ma.
Mrs. Adelaja. Ẹ káàárọ̀ o.
Mrs. Coker, mo rí yín. Àwa mẹ́rin péré náà la ṣe gbé fídíò sí.
Ẹ kú iṣẹ́ o.
Good to see you.
Well done.
Mrs. Kalẹ̀ sanwó mo kí yín o.
Good morning, Mrs.
Gbàtẹ́ gbé fídíò
Rodola.
sí mo ṣe observe pé wà ń bẹ̀.
Ìtàrí ni wà abẹ́ Júbè la máa wà.
Mo ti rí bẹ́ẹ̀, mo ti rí bẹ́ẹ̀. Ṣùgbọ́n ó yẹ kẹ́ dìde kẹ́ ṣe
Morning,
exercise.
everyone.
Good morning, everyone.
Mr. Kingshola, ẹ káàárọ̀ sà.
Good morning, Ẹ káàárọ̀. Mrs. Rodola, thank you very much.
You are welcome, sir.
Ẹ káàárọ̀.
Ẹ káàárọ̀, ẹ kú òru, ẹ kú every
Mrs. Akinwumi.
time tá a bá wà o.
Greetings o, ẹ rà mà.
Ẹ káàárọ̀ ma o.
Ẹ kú iṣẹ́, ẹ kú iṣẹ́.
Yes, ma. Yes, sir.
Ẹ kú iṣẹ́ o. Well done, ma.
Mrs.
Well
Ayinde,
done.
ẹ ṣeun.
The sun.
Ẹ kú àná.
Ẹ káàárọ̀, ẹ kú ìrìn àná.
Kára di ẹ ṣe gan ni. Yes,
It's
ma.
very sunny
Mrs.
inside.
Ayinde.
Yes, ma.
Ẹ
Thank you
káàárọ̀,
very
Káàárọ̀.
much.
Sister
Thanks
everybody.
for
Motosho,
mentioning it.
Yes, ma. Ẹ káàárọ̀, ma. Ẹ
Ẹ
káàárọ̀, ẹ
káàárọ̀, ẹ
good to
kúṣẹ́.
see
ṣé.
you.
Yes, sir. Yes, sir.
Well done.
Yes, sir. Okay, any
Thank
nice
you.
day. Nice
And
day
have a
ahead.
wonderful
All right.
Everyone.
You
bye.
too.
You
Bye. Bye.
Well done.
Ṣé wà
well
ó,
done.
Bọ́lá?
Yeah.
Ẹ kú gbogbo.
Well done. Well done.
Thank you.
Thank you. Ẹ ṣé
You're
o.
welcome. So I
All
am
right.
ending the meeting until the next 2 weeks.
Okay.
We are going to be discussing finance and business. So we look forward to seeing you. Bye.
By God's
Bye-bye.
grace.
Bye-bye.
Bye.